Hi, this is Daniel DiTuro. There are two main types of food fears: genetically inherited and psychologically induced. In this video, I'm going to share information about both types. Many food fears are genetically inherited. People with lactose intolerance must avoid milk and dairy products. People with celiac disease must avoid the protein gluten found in wheat, barley, and rye. Peanuts and tree nuts can cause life-threatening allergic reactions. Other common allergens include eggs, fish, soy, and seafood. Some people have an inherited dislike for slimy foods like eggplant and mushrooms. Some refuse to eat raw tomatoes and similar foods. There are people who cannot tolerate even a small amount of alcohol. And many people avoid bitter foods like broccoli and leafy greens because bitter is associated with poisons. We are genetically programmed to like sweet foods and dislike bitter and sour foods. Years of trial and error has proven many bitter-tasting foods are not only safe to eat, they are packed with healthy nutrients. Even with this knowledge, millions of people still prefer eating only comfort foods they know will not make them ill. Modern food fears are mainly psychological. Some are based on facts, while most are based on profit. Food manufacturers are going out of their way to profit on a growing number of psychological food fears. A few of the top food fears include genetically modified foods, biphenyl A, ingredients like high fructose corn syrup, nutrients like carbohydrates, specific foods like wheat and sugar, and synthetic pesticides and herbicides. I've discussed the last three in previous videos and will share information about the first three in this video. Some food fears, like the heavy use of synthetic chemicals, are valid, while others are manufactured to increase product sales, promote fad weight loss diet plans, or sell a variety of dietary supplements. The internet is saturated with dietary warnings. Does gut doctor mean a board-certified gastroenterologist, a self-proclaimed gut guru, or a scam to obtain personal information? And why does the warning apply only to Americans? Do Americans possess a trait other nationalities do not? In most cases, these ads are clickbait for websites selling worthless products or services. There's a growing concern about genetically modified organisms. U.S. food manufacturers and suppliers spend millions of dollars defeating GMO labeling laws, and then spend millions of dollars testing and labeling hundreds of prepared foods that have never been GMO or have GMO ingredients. GMO foods used for prepared foods include corn, canola, soybeans, and innate potatoes. Some food companies voluntarily label foods with GMO ingredients. Many prepared foods have inexpensive GMO canola, corn, and soy ingredients. To date, there are no GMO oranges, so all orange juice is non-GMO. The USDA issued its final GMO labeling rules in December 2018. The rules exempt about 75% of food manufacturers and suppliers, and requires using bioengineered or derived from bioengineering instead of politically incorrect genetically modified. Companies have until 2022 to comply with the new labeling rules. Soon it will be out with the old fear-inducing genetic engineering and in with the new cheery derived from bioengineering. The new rules apply to fresh and prepared foods. So remember, bioengineered equals genetically modified organism. For years there have been warnings about bisphenol A, BPA, used to line food cans and in other products. Lab animal studies showed BPA could adversely affect fetuses, infants, and young children. To alleviate this fear, some food manufacturers have replaced BPA with other lining materials. Which materials? It can be bisphenol S, BPS, or diphenyl sulfone. There's no data proving these alternate materials are safer or as harmful as BPA. A list-topping food fear is high fructose corn syrup. It has two strikes against it. It is made from GMO corn, bioengineered corn, and some claim it is the root cause of America's obesity epidemic. High fructose corn syrup has been used in thousands of prepared foods since the 1970s as an inexpensive sugar substitute. In addition to its empty calories, dozens of internet websites warn about fructose toxicity. A sugar found in fruits and vegetables like kale is supposedly toxic to humans. Cauliflower, the poster child of many low-carb diet plans, is classified as a high fructose vegetable. Negative publicity surrounding high fructose corn syrup has prompted some food manufacturers to switch back to refined white sugar. Some diabetics use high glycemic index, high fructose agave nectar instead of sugar. 95% fructose agave nectar has a significantly lower glycemic index than refined white sugar. In most cases, a diet high in added sugars, not natural sugars including fructose, is the cause of most diet-related diseases. When a food makes you ill, you have a legitimate reason to avoid eating that food. If you are concerned about chemical can linings or food additives, you have the option to buy fresh or frozen produce. Organic produce is grown without synthetic pesticides. If you are overweight or obese, the problem in most cases is not refined carbs or high fructose corn syrup. It is a diet high in added sugars. Many modern food fears are based on animal studies only that have not been replicated in humans. How many of you remember the 1970s saccharin scare? Saccharin was proven to cause cancer in lab animals and a possible human carcinogen. 50 years later, pink packaged saccharin is still being sold and served, and there has been no mass extinction of saccharin users. Popular low-carb, paleo, keto, and other fad diet plans use animal studies and small human clinical trials to justify their diets. Most headline-grabbing, fear-inducing animal studies quickly fade into obscurity. Please leave a comment if you have any questions about this video. Thank you for watching, and healthy eating!